It's kind of a labor of love. We have healthcare disparities between urban centers in North Carolina and rural areas of North Carolina. Family medicine specifically is big on continuity of care, providing care to a patient and their family from cradle to grave.
It's truly the only specialty that you can, really do womb to tomb, like literally all aspects of life.
Providing world-class residency training and serving a public need in the communities of Ahoskie, North Carolina, which is approximately an hour drive north of us here in Greenville. The community of Beulahville and Kenansville, both of which are in Duplin County, which is about an hour drive south of Greenville. And the community of Roanoke Rapids, which is about an hour and a half, 45-minute drive northwest of Greenville.
It is the kind of place that I imagine where I will be living for the rest of my life. I like the beach, I like the mountains, and if I want to go to the city, it's very accessible.
We were told by everyone involved that getting a rural family medicine residency training program would probably take 10 years to get it up off the ground. We got it off the ground in 2 years.
So the program itself is very robust. The community is very supportive.
We provide this very intense, inpatient-heavy first-year experience for these rural residents.
Our first year takes place at the mothership.
A lot of people don't realize that ECU Health Medical Center here is one of the largest hospitals in the United States. It's actually the largest hospital in the state of North Carolina. And even though many people in cities like New York or LA would consider Greenville rural, our catchment area is massive. It's almost the size of the state of Delaware. We serve about 1.5 million people. Anything and everything that you can imagine seeing in residency training, you're going to see here at the Big House.
It is truly very, very difficult, and I think anybody that's been through residency can attest to the same. You have a lot of resources, you have a lot of assistance at your disposal. You also have a lot of a high acuity and very, very, very sick patients. So from a learning standpoint, it is an excellent opportunity to see unusual diseases.
We have intentionally set up their curriculum where 2 months of their first year they spend exclusively in the rural environments at their rural continuity clinic. And then half a day a week, every single week, they spend in the rural communities in their continuity clinic to start to develop some sense of ownership and belonging to these rural communities, to start to get to know the populations they're going to be serving for the 3 years of their residency. And then second and third year, they spend their entirety of their residency training in earnest in these rural communities. One of the other major focuses of our program is we don't want our residents to just be cognizant of rural issues here in Eastern North Carolina. We want them to see the global picture. Our rural residents went down to the Dominican Republic, where they spent some time in very rural, very remote villages in that country. This gives them a more holistic, global perspective on rural care, and it also helps connect them to their patient populations that they serve. A lot of people don't think of Eastern North Carolina as being multicultural, multi-ethnic, but it is in fact a very multicultural and multi-ethnic place. There's a sizable migrant farmer worker population, and our residents actually go out in mobile clinics onto these farms and take care of these patients where they live and work.
My patients are very appreciative of what I do for them. I treat them as a whole, and I get to know them as a whole being.
When you finish training with us, you are going to have the complete skill set. So you will literally be able to set up shop anywhere in the world and feel comfortable seeing the overwhelming majority of things that walk through your door. These rural communities are great places to live. It has a low cost of living, high quality of life. If you can get a resident physician through that threshold to just go to the rural community, what they find is this is actually a really pleasant place to live and work and potentially set roots.
When you go out of the clinic, you'll see your patients everywhere. You meet them in the pharmacy, you meet them at the local neighborhood grocery store. It's more of a family community, I would say.
Ultimately, your role is there to not change the community or fix the community. Your role there is to assist in whichever way that they need you to. I think that's what really drew me, is just the fact that being that you're in a small community, small differences truly go a long way, and you see them.
I feel like if I'm able to treat them and help them in any way that I can, I'm making a big difference in the community. And it's very fulfilling, and it's such a humble experience to be able to see them back better.
Moving forward, I see nothing but growth for us. I would like to see additional rural sites. I would like to see a larger program, because we are truly doing mission driven work and trying to bridge the chasm of healthcare disparities between urban centers and rural areas.
My goal was to make a difference and make an impact in their lives, and I think with my training, with my skills, with what I've learned, I'm becoming that doctor that I've always imagined to be.